friends, hope you guys doing good and revising well for your INI exam. So in this video we shall be discussing regarding your name, triads and surgery. So what makes us make this video for you? There are two reasons for this. One, that you have some direct questions that have been asked from the triads, being say which of the following is not the component of the given triad, and second, the most important one is that you might be given a clinical scenario where there might be components of this triads which would be a clue for you in forming the diagnosis and solving the question subsequently. So let's start with the first triad that we have, which is your same triad. Now same triad components include your diverticulosis of colon, then we have your gallstones, and we have your hiatal hernia, right? The most important confusion that is often created over here is by given diverticulitis, right? So please remember, it is diverticulosis of colon which is the component of your same triad and not the diverticulitis, right? So let's move on to the next triad, which is your Whipple's triad. So what are the components of your Whipple's triad? It is symptoms of hypoglycemia, right? Then we have your blood sugar level which is less than 45 mg/%, and the symptoms are relieved by glucose administration. So where do we find this? So the symptoms are relieved by glucose administration. Now if you are getting this classical triad, it is a clinical clue to you that it is a case of insulinoma, right? So you might get a question that there is a 45-year-old female who is presenting to you with symptoms of hypoglycemia, and you find the blood sugar level of 45 mg/%. Then you have the symptoms which are relieved by your glucose administration. What will be your diagnosis? Right. So over here we are discussing regarding your Whipple's triad. So it is an insulinoma, which is your pancreatic neuroendocrine tumor. Now the next triad is your Murphy's triad. So what are your components of your Murphy's triad? So first is pain in your right iliac fossa, right? Then we have your temperature, that is patient is having fever, and then we have vomiting. So what do you think with this clinical scenario you can think of? Yes, it is a case of acute appendicitis. So your Murphy triad is seen in your acute appendicitis. Now the next triad, which is your examiner's favorite, have been asked multiple times and we cannot make a mistake in this, which is your Charcot's triad. Now what is your Charcot's triad? It is intermittent fever, then we have intermittent pain, and then we have your intermittent jaundice. So the next question comes, where is it seen? It's seen in your ascending cholangitis, right? Now I'll just add an important point over here. If with Charcot's triad you find hypotension, and to that let's add altered mental status, right? This forms another important question, which is your Reynolds pentat, right? So apart from this, there is one more important triad which I have not mentioned or not drawn over here. So let's draw that triangle, which is your Regulus triad, right? So let us discuss regarding your Regulus triad. Now, what is this Regulus triad? Now, this regular triad is a component of pneumobilia. Then it has your features of small bowel obstruction, that is your dilated bowel loops, and it has a radio opaque shadow in right lower quadrant of the abdomen. So where do we find this regular triad? And this is classically seen in your gallstone ileus. So if we visualize what sort of questions can be formed from here, a 55-year-old lady presents to the emergency with pneumobilia. A radio X-ray was done where a radio opaque shadow is seen in the right lower quadrant and dilated bowel loops are seen. So what will be your management, right? So first you need to form the diagnosis. So the diagnosis is gallstone ileus. Now the most common site is your terminal ileum, right? Now please remember the treatment over here will be relieving the obstruction. That is, we are going to make an enterotomy and remove the stone. Please remember, cholecystectomy is done at a later time. It is usually not done in the same setting. So as you can see, these are the sort of questions that can be formed and framed from the triad, right? If you know the components of this triad, it is going to be easy to form you the diagnosis, which is going to take you to the next step. Now they might just ask you what is the most common site of the pathology, right? So this were a few important points regarding your Charcot's triad, Reynolds pentad, and your Regulus triad. Now let's move on to the next triad, which is your Tilloch's triad. Now what is your Tilloch's triad and where is it seen? So first let's know the components of your Tilloch's triad. So it is a soft. Please remember that this all words are important. They might just twist the words like soft, hard, cystic, non-cystic, right? So soft, fluctuant, swelling in the umbilical region, right? Then what you have, zone of resonance all around, and we have the swelling is freely mobile in direction perpendicular to mesentery. So if you get a clinical scenario with these features as hints, it is Tilloch's triad, and they are hinting you to the diagnosis of mesenteric cyst, right? So now let's move on to the next, this Cushing triad, a triad where we cannot make a mistake, seen in intracranial hypertension. It has been asked repeatedly. You will find this commonly in your head trauma questions. So what are your components of your Cushing's triad? First you have your increased blood pressure, then we have your decreased pulse rate, and then we have your irregular respiration. right? So please do not forget this triad, as you find generally this in your head trauma patients and patients with your intracranial hypertension. Now moving down to the next triad, we have your Bouchard's triad. Now what is your this Bouchard's triad? So first let's know the components of this Bouchard's triad. So we have patient presenting with acute epigastric pain. Then another hint that you get that the patient is having violent vomiting, and when an intern was trying to put the rice tube, so it was inability to pass the orogastric or the nasogastric tube. So when we are dealing with these features, this is a classical example of Bouchard's triad seen in your patients with gastric volvulus. Right. So if you see, the question that might come to you might seem to be a complicated one, but if you take help of this few clinical clues, you are going to make your life easier and form the diagnosis and answer the subsequent questions or form the diagnosis. Now the next one that we have is your macular triad. So what are the components of your macular triad? So we have vomiting, chest pain, and your subcutaneous emphysema. So where is this macular triad seen? So it is seen in your Boerhaave syndrome. Right. Now there is another important triad which is associated with your esophageal rupture. Right. Even I had got confused with this. Now this is what we call as your Anderson triad. So if you look at the Anderson triad, the components of your Anderson triads are actually different from your macular triad. So first we definitely have subcutaneous emphysema, right? Then we have your abdominal rigidity, and we have your rapid respirations. So these components are of your Anderson triad, and this is also seen in esophageal rupture. Right. Now moving on to the next triad is your Sandblom triad. So what are your components of your Sandblom triad? So the first component that we have is jaundice, then we have pain, and we have your melena. Right. So where is this Sandblom triad seen? Now this is classically seen in your hemophilia. Now the students often confuse the Sandblom triad with another triad that is seen in your hemophilia, which is known as your Quincke's triad, right? So even this is seen in your hemophilia. Now what are your components of your Quincke's triad? So basically it is again the same components itself, right, which is jaundice, melena, and your right upper quadrant pain, right? So unlike what we had discussed in your esophageal rupture, where your macular triad and Anderson triad were different, over here Sandblom and Quincke's triad are not different. So what you need to remember is that Sandblom is another name of your Quincke's, and essentially the components of both the triads are same, right? So please do not get confused like in macular and Anderson. So that was the main purpose to write separately over here, so that it fits over here that yes, Sandblom and Quincke's are same, whereas macular and Anderson have some different components. Now we have the last triad that we would be discussing, which is your Galeazzi triad. So what are the components of your Galeazzi triad? So first we have your retroperitoneal fibrosis, then we have your Peyronie's disease of penis, and we have your Dupuytren's contracture. Right, so these are your components of your Galeazzi triad. So the question that usually can be formed from your Galeazzi triad is which of the following is not the component of your Galeazzi triad. Right, so this were your few important triads which I had kept for the discussion for today. So please remember this triads, knowing this triads can help you get a clinical clue in your clinical based scenario questions, which would help you to solve the questions faster and even correct. Right, so that's all from this video. Thank you.